Okay, so today I'll be doing a intraoral exam. This is my patient, which is a type dot. I would first start by asking permission to record, and once they give consent, I would start with the inspection of the vermilion border of the lips and the surrounding areas. So I would just kind of look around and check for anything abnormal. This is done with just looking at the patient. You don't have to touch them or anything, just the initial look at the patient. And after I do that, I would explain them my whole procedure and make sure that they remove any partial or complete dentures in their mouth. I would then use the mirror to inspect the oral cavity. I'm looking for any herpetic or lesions or red or inflamed throat. So I would just do this with my mirror. Push the tongue down a little bit to get at the throat. I would then look at the labial mucosa on the lower lip, the upper lip, and then both of the cheeks. So I would do this by pulling back the lip, the lower side, just inspect around. And I'll do the right cheek, left cheek. So now I'll look at the underlying structures of the lips and cheeks by palpating to look for any swollen nodes, changes in texture, or tenderness. So by doing this, I'm just going to palpate around the lips. So this is the lower lip, and then with the upper lip, and then same thing for the cheeks. And I'm just looking for anything that feels unusual. I'm now going to inspect the floor of the mouth and also palpate. I can do this by lifting the tongue for the patient, or they can also lift it by themselves. And I'm going to just take a look in there and then palpate. I can then pull the tongue left and right to look at the sides, and I can use either my fingers or I can use cotton gauze. I'll just use my fingers for this time. So now I'm going to examine the submandibular and sublingual ducts. I can do this by taking a cotton applicator to evaluate the functions, and then also just by looking at it visually. So for the parotid ones, we'd go in here, and then sublingually would be underneath the tongue. And now I'm going to examine the tongue. So I can have the patient lift the tongue to the top of their mouth, or lift it for them. And then I'm going to look underneath there. And then if I have to pull the tongue forward so I can take a good look behind, and then pull from side to side so you see the sides. And then I'm going to palpate it. Lastly, I'm going to examine the palate and the tonsils, the oropharynx. By doing this, I'm going to start off by visually inspecting it. I can do this with the mirror or just by direct vision. So I'm going to take this to look around. And then lastly, I'm just going to palpate the hard and soft palate in the mouth. I'm going to try to not go too far back because this will trigger the gag reflex.